Welcome to Boston University's Occupational Therapy webinar series hosted by Pi Theta Epsilon, PTE. We're really glad that you can all join us today. This webinar series is designed to discuss new and emerging practice areas in the field of occupational therapy. And this is the first of 4 webinars that will be held across the semester. The next webinar will be held on February 27th, and it will be about OT in primary care and OT in the NICU. But today's webinar is presented by Claire Craig. We're very excited to have her. And the topic is Design for Healthy Ergonomics. I'm sure you'll have questions throughout the webinar, so please feel free to type those questions in throughout the presentation via the panel on the right-hand side of your screen. After about 25 minutes of hearing from Claire, we'll take a quick pause to go through some of the questions that have come up, and then the presenter, Claire, we'll go back into some more depth. Feel free to send in questions at any time. We'll save them for the question period. And now we will welcome Claire to begin her presentation.
Thank you very much. Thank you for your hospitality, and thank you so much for inviting me to this webinar. It's very exciting. So my name is Claire Craig, and I've been an occupational therapist for 20 years, and I live and I work in Sheffield in the United Kingdom. So you can probably tell that from my rather northern accent. So Sheffield is a kind of medium-sized city in the UK. It's quite industrial. And at the moment in Sheffield, it's about 10:30 at night. So it's a very different experience. What I'd like to share with you this evening is, I suppose, my journey within occupational therapy that has brought me to the point of being a co-director of an interdisciplinary research centre that brings together design and health. And that's going to be the focus of my webinar this evening. I'm thrilled to be here, and I'm really happy to take questions. I'd like you to interrogate me, to ask me difficult things, and to really enable us to explore this topic together. I'm far more used to engaging in very interactive sessions with people, so the more questions, the better. So as I say, I live and I work in Sheffield. I teach on the occupational therapy programme in Sheffield. We have about 36,000 students at the university, and we have approximately 100 students a year across the different programmes of bachelor's, master's and postgraduate. We have an amazingly vibrant and energetic group of future occupational therapists. They organise something called the Sheffield Hallam Occupational Therapy student team, and they host and organise evening lectures and do outreach to schools and to maybe new and emerging areas of practice. So they're our greatest advocates, and I'm incredibly proud to be part of that. A fellow of the College of Occupational Therapists, and in large part that is in recognition for the work that I've done in the field of moving the boundaries of occupational therapy forward in the United Kingdom, and it's been a real privilege and pleasure to do that. And that's me. If you're looking at the slides, I'm the person with the glasses and the rather strange smile on what I'm looking at as the right hand side, but it could be your left hand side. But my passion really has and always has been working with older people, and really repositioning and rethinking who older people are, and enabling people to live well and to manage significant transitions throughout the life course. So my PhD was in the field of photography, using photography as a method giving people living in care environments cameras to enable them to talk about what was important to them in the context of their occupational needs. So if you cut me down the middle, you would find that it would say occupational therapy right the way through. I am passionate about our profession, and I still believe after 20 years it's absolutely the best job in the entire world. I think what we can do in our work is I think we can challenge and really think where we position occupational therapy. And I think we've got so many opportunities at the moment, particularly in terms of this very big preventive health agenda, and thinking about ways that we can promote and support a whole range of different ways of working, including active ageing. And again, in the United Kingdom, in my research group, we piloted and we developed in partnership with older people, a preventative programme focusing on enabling people to keep maintaining their occupation and occupational well-being throughout the life course, particularly at points of transition in the ageing process. And that programme was called Lifestyle Matters, and through that work, occupational therapy was recognised as an intervention of choice in promoting well-being for older people. So I think, you know, as we're entering into a really exciting period in occupational therapy. In England, for many, many years, occupational therapists only ever really worked in the National Health Service here. I know that's very different than in America, but as a consequence of that, I think occupational therapists, we got quite stuck in only working in this one field, and people really didn't see us beyond the hospital and community work that we were doing there. Often we were just responding to need rather than maybe exploring and going back to thinking about what occupation is, and about enabling people to really manage these kind of points of transition and to enable people to maintain a sense of occupational connectedness in what they're doing. And I do believe that as in England now, we are at this point where we're starting to challenge some of these notions of what occupational therapy is and what occupational therapists can do, still going back very much to our roots and where we began from. So that's the kind of context in which I work. I think as occupational therapists, we are absolute experts at understanding this relationship between the person, the occupation, the environment. And I think we're experts at adapting the environment to meet those needs. So occupational therapy and design, this kind of field of design, fit together incredibly well. We're natural designers. We think naturally about the context and these different contexts where we work. As we know, in OT, we compensate for disability. We use and create environmental adaptations to maximise function, and we promote health. You know, as I said, you know, a lot of my work is around thinking about how we enable people to manage these significant points of transition through kind of broader interventions. And I love that the example of the playground for people like me, for adults. As OTs, certainly we promote social inclusion. So in one sense, working and thinking about occupational therapy in the context of design isn't new at all. It's something that we've done for a long, long time. But in another sense, as we're moving into these new and different contexts, rethinking what health is and what health means, then we have to rethink where we position ourselves as occupational therapists to be most effective and to promote the most significant change. And certainly we're seeing this in the Healthy Cities initiatives, looking at kind of global health movements, in the work of technology, which I know Karen Jacobs is very much leading, and also both in terms of some of the materials that we might be using. And again, with the advent of 3D printing, having to rethink what does occupational therapy mean in these contexts when we're thinking about what we do, design and the environment. These are all kind of key aspects of ways that we might work, and we need to reposition ourselves in where we're working and maybe our practices. I think at present we have some really interesting spaces. I'm very interested and always have been interested in how design and the design of many of the assistive products that we use actually lead to a medicalisation of the home environment. The objects that we have in our homes shape the meaning of home, but equally the places where we use these objects also shape the meaning of the objects. And a big challenge I think we've had for a long time is an assumption that we can take objects that we might use in hospital, products we might use in hospital, and fit them easily into the home environment without really thinking about what they become in that setting, but also what it makes our home become. As I said, I think there's a really interesting conversation to be had. If we believe that occupation is so powerful, particularly at points of transition when people are becoming ill, and as a way of enabling people to rehabilitate, then surely as occupational therapists we become interested in the role that occupation has in preventing ill health. And we hear a lot of talk about the role of lifestyle and about the types of things that we do and about meaning. And I think, again, very, very interesting space for us to work in. And then also I think that we're working increasingly with populations, particularly around ageing and older people, where there are changing expectations. And again, maybe some of the products that people were happy to accept, 10, 15 years ago, people are not as happy to have in the home environment. So again, very, very interesting questions in terms of what the products actually mean and how they relate to other parts of our lives, and also how we see ourselves, and some of the ways that stigma can be created through the types of objects and the products that people at points of occupational disengagement and people living with disability can experience as a consequence of some of the things that they might use. So as an occupational therapy researcher and practitioner, so I still practice, I think these areas and this area warrants further exploration. So 10 years ago, I was privileged to have a conversation with a very good friend and colleague in design, Professor Paul Chamberlain. And Professor Paul Chamberlain, he's a professor, he's a furniture designer working in the Research Institute. My colleague, Professor Gail Mountain, so she's an occupational therapy researcher, again in Sheffield. And myself and another person called Joseph Langley had a conversation, and we realised that actually what my colleagues in design were talking and describing were very much the things that I was very interested in understanding more about as an occupational therapist. And we discovered that there was a massive overlap in our mutual interest. And so 10 years ago, we established a research cluster called Lab for Living. So Lab for Living is a research cluster that brings together design, creative practice and health. We are essentially a transdisciplinary research group, a collaborative community of researchers in design, healthcare and creative practice. And the designers that I work alongside are designers who work in graphic design, in fashion design, product design, and interaction design. My colleagues in occupational therapy, in physiotherapy, and in nursing. and in creative practice I work a lot with fine artists and people engaging in film and media. And my role within this Lab for Living is I am the co-director of the research group. So our work in Lab for Living is underpinned by a number of key principles. Above all, our work is we design with people. So we work in collaboration with people who use services, really recognising and drawing on their inherent strengths and their assets and their knowledge, which is based on their personal and their professional experiences. We use creative practice, creative, if you like, drawing, art, making, in whatever form that is, photography, as methods and tools for research to actually engage people and to understand the challenges that they face, but also to visualise new possibilities and future scenarios. And I'll talk a little bit about that in the context of why I think that's really valuable in occupational therapy and what we bring to that. And then finally, we work very much with the industry, with the broader healthcare, government and educators in the United Kingdom and beyond. And that's really to maximise the impact of occupational therapy research and to ensure that it's world changing. So within the research cluster, we have a whole strand that is industry based, because we believe that rather than creating very niche market products, it's much more effective to work with organisations to produce mass markets of products that everybody can afford, that just makes life better for everyone. So, for example, why buy an addition to a jar turner? If you can't open a jar, why buy the addition to have to then use that to open a jar, rather than actually designing a jar that's easier for everybody to open? So we are really grappling with these types of questions rather than having a bath board and seat for people. Why don't we just design baths that can change as people age? And so these are the areas that we become very, very interested in. So working with industry is incredibly important. Also working with government is important. So what we do within our practice in the lab, we create interventions that actually lead to changes in policy in government, acknowledging the importance of occupational therapy, but also thinking about the role that design has to play in the broader environment. So we think very much then about, yes, as occupational therapists working individually, designing things for individuals, designing things for groups, but also working with town planners and with local government to redesign cities and redesign public spaces and to rethink the configuration of what a city is. So I lead on a project in Sheffield around designing dementia-friendly environments, for example, that makes the entire city into a space where people with dementia can thrive because of the understanding and the way that the environments are enabled and changed to manage and support people with cognitive needs. So we have big visions, and over the last 10 years, I think we've had over 100 projects worth millions and millions of pounds, and many of those projects and products have gone straight out to market. So we've got a very good in terms of how we work and affecting real change. And I suppose if there's one message from my webinar this evening, it's thinking big and seeing the possibilities that occupational therapy offers on these very, very different and multiple scales. And that isn't necessarily for everybody, but just saying, gosh, we have these incredible talents and this amazing understanding. And perhaps part of the opportunity that we have is to use that, not just in terms of recommending and identifying different types of equipment, but also in working at the design level, right through to its manufacture and to its dissemination. because I think that there are so many opportunities that we really have there. So, oh great, so we've got some questions, brilliant. Please keep ask any questions. I'm really happy as we go along. What I thought we might do is I'll describe just a couple of case studies, and then if we stop and I'll respond to any questions that you like, or I'm happy to respond to questions now. What would you rather? I'm very English and very accommodating.
Hi, Claire. Let's speak briefly about the case studies first, and then we'll go through some of the questions that have come in.
Is that okay? Yeah, I will do that then. Great. It will give you a flavour. It will give you a flavour. Brilliant. Thank you. Okay then, so I'll describe some of the case studies, and I've just taken a few here just to show a kind of variety, if you like. I think I'm particularly interested. I've tried to pull out some case studies that reflect on the value of the interdisciplinary working, particularly working with industry, and also maybe thinking about some of the methods that we use and that we might use within occupational therapy as well. And this shift from provider to designer of products and equipment. Okay, so this is going to be my focus. So I'll begin by describing a project which was around, that we received funding for, which was around future bathrooms. So we know that bathrooms are a really interesting space in the home. We know that often the reason why people might have to move out of their existing home into assisted accommodation often occurs because of the inappropriateness of the bathroom environment. And we were commissioned, we received funding from the Engineering and Physical Science Research Council to undertake a piece of work looking at future bathrooms. And this project offered a number of interesting opportunities, but also some challenges. So the bathroom has a number of different meanings, and those meanings change as we move throughout the life course. So maybe when you're very small, when you're a child, maybe the bathroom is about play. As we grow older and in our early 20s, maybe the bathroom might be about romance and relaxation. And then as we get older, the bathroom can become more functional and people become more preoccupied around fear, and it becomes a place where people worry about falling or being able to get in and out of the bath. So already we have a really interesting question in terms of what this space is. And as researchers in terms of designing a new bathroom, as an occupational therapist really thinking about what the bathroom is, we wanted to understand a lot more about what really happens in the bathroom. So the project began by seeking to interview and talk to older people about their habits in the bathroom spaces. And of course, in England, people wouldn't talk to us. Older people didn't want to talk to us about what they did in the bathroom. It was quite a taboo subject. So we built something called a field lab, and you can see that on the screen. It looks a bit like a giant maze. It looks like a bit like a giant maze. And what the field lab did is it was a public space that we created with various configurations of bathroom equipment and different layouts of bathrooms and different objects relating to bathrooms. And we invited people to go into the spaces and to interact with and to comment on what those spaces were. So we had things like a graffiti wall where people could actually write and record their responses, a bit like, as a way of kind of recording research data, because in England, graffiti is kind of synonymous with public bathroom spaces. We also had something called the bog blog, which was a bit like a big brother room where people sat on what looked like a toilet and they video recorded their responses to some of the areas that they were seeing. And this was a fantastic way of really generating some very, very useful data, because in design, often the product isn't the end point, it's the beginning point. I can tell you the ergonomics of a chair, but you don't really know what you want from a chair until you sit in it. And that's the same with the bathroom. So we created this thing called the Field Lab, and we recorded a huge amount of data. Really insightful, incredibly useful. Then we worked with older people, and we employed a group of older people as community researchers. So rather than ourselves going out, because we were quite a young research team, feeling that people might not talk to us, we actually empowered older people themselves to be in the community, to interview other older people and to find out about, well, what was it that mattered? What was it that happened in the bathroom? What was it about the types of equipment that people were using or needed to use? And that was incredibly powerful. And they actually, as I say, created something called the Bog Blog. From that work, we then worked with the world's largest bathroom manufacturer to put some of those ideas into practice. And some of the ideas that the older people had and that were generated from that program were things like having sinks that could raise to different levels, so that people could sit on the toilet and wash their feet, but also so that people didn't have to bend over to stoop to wash their hands. We worked with material scientists to develop floor covering and floor tiles that had the same level of ability to be cleaned as standard tiles, but actually were almost a bit like what you'd find in a playground, in that it had a level of buoyancy so if you fell, it wasn't as hard a surface, so there was a sponginess to that. We also created a very interesting manual, a product brochure, because older people told us that actually when they'd been in their 50s, they'd kind of repurchased their bathroom furniture, and actually if they'd have known then what, if they'd have realised then what they knew now, they would have done that differently. So we created a product brochure that was then adopted by a very big organisation called Theta to publicise and to talk about the importance of ergonomics in the bathroom, and what was of value, signposting people to therapists who could support understanding, but also really helping people to see what the possibilities were in a very educational way. And that last year won an award for being the most innovative product for people in their 50s, because actually giving people that power and that understanding was really quite revolutionary in the UK. So, thinking about the role that OT has within that, so that little project really led to some very interesting areas. We ended up also working in Turkey, where we became very interested also in culture within the context of bathrooms and what that meant. So that was the Future Bathroom Project, and that so that led to some really, really interesting outcomes. So that's the first case study. So the second case study, leading on from that, was a project called Engaging Aging. Again, as occupational therapists, I think we're very interested in this idea about how people manage life transitions and periods of occupational connection and disconnection. And what does that really mean in the context of growing older? So we were funded through the British Council to undertake a piece of research comparing the experiences of older people in Sheffield and Taiwan. And that project again was really looking at what is it to grow older, how can we start to help people to understand what the aging process is, and the types of things that people might want to think about in the future, particularly in terms of the context of home and the environment. So we interviewed people in Sheffield, and then we turned what they said, and this sounds slightly crazy, but we turned what they said into pieces of furniture. So the project was about embodying what they told us in objects, and the objects were not meant as solutions, but they were meant to promote conversation about aging. And we work with the Museum of Contemporary Art in Taipei, which is held in the underground. And we had a footfall of about 50,000 people a week in that to that exhibition, talking about growing older and talking about what it meant to grow older and the challenges in terms of aging, and the physical changes that were occurring and what that meant in the context of people's homes. So if I describe a little bit more about when I said we turned people's data into objects. So people said that when they were younger, they would have cosmetic tables full of lipsticks and blushes and makeup. But as people grow older, that same dressing table became full of tablets and syringes and medical equipment. So we called this a cosmetic table. This product here that you can see, this was called See Here. So people talked a lot about the fact that as people aged, that people became more excluded because they couldn't have the same conversations, and that led to loneliness and isolation and occupational disengagement. The light here was a comment that for people to actually engage in meaningful activities, you need to have the same level of visual acuity as you grow older. You need about 6% more light, and that is often something that's forgotten. So actually a lot of the lighting makes a massive difference in terms of people's participation and engagement. So we had a whole range of these objects, and from that we generated a huge amount of interest. We ran workshops in Taipei. We generated lots and lots of interesting findings, and then we took that back to the United Kingdom. We ran similar workshops in London with older people, and then we went back to Taipei. So and again, all the time engaging more and more people in conversations about what it meant to age and what that meant in the context of people's homes and what that did. So that is the project Engaging Aging. So that's just something to share the types of methods and cross-cultural work that we do. And we realised very quickly that we were invited then to go to share what we were doing in terms of thinking about this in the context of older people and thinking about aging in other countries. And the idea of the exhibition was something that people really saw as a way of not just generating research, but also raising the profile of what we were doing, and certainly raising the profile of health and of occupation. But we realised that as people were asking us to take the exhibitions to different spaces and places, that it was becoming more and more problematic. And we were working out in Switzerland, and we saw Duchamp's museum in a box, and we had an idea that we could maybe condense what people were talking about. Maybe we could actually put the exhibition, put this method of actually understanding people's experience and what was important to them, could we embody that in 9 objects? And so we built something called Exhibition in a Box, which is, as you can see in the pictures, is our 9 objects. And that we believe you can have any conversation with, and the objects themselves act as ways to elicit experiences and understanding and help people to talk about what is important to them. So it's a fantastic method to do that, and it was so successful as a method within the research tool that it was found that that actually people talked a lot more about the home and about what was important in terms of meaningfulness. But as a consequence of that, in Switzerland, it's now used by occupational therapists as an assessment tool to actually start to build understanding of who people are. This is not reminiscence. This is using critical artifacts, using objects as a way to talk about things. And as occupational therapists, you know, how often do we use checklists to talk about to have interviews with people, but actually how do we interact with the world? How do we engage in occupation? Well, we engage in occupation through objects, and so this is a very, very easy way to do that, and to to have these conversations. So that's kind of something about maybe the methods and the areas that we work in. Yeah. So I suppose just to pause here, and I think it will be a good opportunity to take some questions before I move on to some of the ways that we might kind of put these things into practice. But I think what I would say, so I work in a design lab and I work in a design department, but I think as an occupational therapist working in this area, I think what we bring as OTs is this fundamental understanding of our engagement, of people's engagement with the environment and what the environment does and what the environment offers. We bring an incredible understanding of the ergonomics and of an understanding of how aging and people living with different conditions, how that impacts on the ways objects and products should be designed. But I also think as occupational therapists, we look at the whole picture. So we also understand that actually there isn't such a thing as a neutral product. Everything that people have has some level of meaning and will have some level of meaning in what that transmits. And I think we're incredibly well placed. I feel incredibly well placed within this department to really to move that work in ways that really I think kind of highlights just the skill set that I think we bring to this field of design. So I'm going to pause there for a second to listen to some questions, and then I'm going to show some examples of some of the products that maybe relate to some of the ergonomic design that we've been working alongside, if that's appropriate. So over to you, Jack and Co.
Okay, thanks so far for a really engaging presentation, Claire. We have a number of questions, so I'm just going to jump right in. Here's one from Grace. She says, thanks for your great lecture. She's wondering if you have any suggestions for how we as OT practitioners might adapt home medical equipment to make it feel less medical and more like home.
Perfect. Grace, that's a fantastic question, and it's a piece of work that we're doing at this very moment in time. So I think there are a number of aspects to this. My big question is, why does medical equipment have to look like medical equipment at home? There is no reason for that. You know, why does medical equipment have to be of a certain colour or a certain feel when we know that we have such amazing expertise and there are such materials that completely revolutionise what that medical equipment might be and what that medical equipment might look like. And there, as I say, there is absolutely no reason why it shouldn't fit in to what the home environment is and what that creates. I suppose my interest and our interest in the lab is saying, well, actually, if we can design things well, then actually we can design them for a far broader market of people who want to buy things because they're desirable objects and desirable products. And there's a group called Good Grips who've done just that. They make really lovely products that are meant for everybody. You know, this is not about this is just good design, but it appeals to everybody, and it's as equally able to be used by somebody with arthritis and poor grip strength as it is by a younger person who wants something very trendy. So our big bugbear is we just need more OTs working with designers and redirecting their energies and telling them, yes, you need to be doing it like this. We also need to find ways to listen more carefully to what people would like and what people would desire. And I think that whole notion of co-design and co-creation, really listening to people as experts about what those products mean in the home, and yes, let's work within that, and let's do that, and let's do that well, and come and visit us and come and have a look at some of the things that we've got in England, in Sheffield, in the lab, and it would be great to share some of that. Great.
A few of our participants have been wondering about accessibility from a slightly different perspective. They're wondering about design of products for developing countries.
Yep.
And if you have any direct experience with that, or have any feelings about the role of OT when you're looking at developing products that will be available from a price perspective and taking into account issues that the third world might be facing, such as lack of access to water.
Yeah, absolutely. So again, we work very closely with a number of colleagues for whom that is their major research agenda, and on a number of levels. So, for example, a colleague of mine at Sheffield, David Swan, his work has been around, he developed a very simple intervention, which was designing a way of measuring the ratio of disinfectant to water with to reduce Ebola, and that intervention cost literally nothing, and actually has saved so much money and multiple lives. I think I would say that the interventions used are not expensive. So sometimes that can be a way of moving in. The second thing that we would believe and say in Lab for Living is it's about understanding what the communities are doing already, because they're the experts. And so often we've taken things that those communities have been doing and we've just transposed them into other spaces and places. So some of that is about disseminating what people already have and the things that people are already designing in those environments. So there have been some really interesting examples of where people have been using and recycling containers in terms of prosthetics that have worked incredibly well. And you know, our approach would be, gosh, let's learn from those communities. And if there are there other products, or are there other materials that would be as cheap, that would be as easy to use, fantastic. And if not, let's learn from people and let's disseminate that. And then the other element that we work alongside a lot around is around sustainability, in the context of thinking about the broader environment and thinking about how do we ensure that we are not actually over making things, over polluting things, and also creating scenarios where expensive things are flown into space and places that actually completely disrupt the whole infrastructure and systems that are happening there. So I've seen some very poor projects that have happened where in areas where certain things have been taken into an area, and as a consequence of that, that has meant some people have not been able to continue to do the things that they were doing. It's disrupted existing systems in terms of hierarchies around social structures, which actually has been incredibly damaging and unhelpful. So I think for us, it's a balance between the two. Yes, we do work which is about looking at ways of harnessing and capturing very simple materials. So, like, for example, work with places like Bill Gates Foundation, work around, you know, finding ways to create sanitation that is kind of useful and healthy. You know, David Swan's work around the Ebola gauge measurement, you know, fantastic projects. But equally working incredibly sensitively in terms of co-design methodologies where we're learning from people, and certainly the intention is never ever to jump in there and make assumptions about what people are and aren't doing, but learning about that cultural sensitivity, people's fantastic practice, and seeing how we can take that practice and utilize that in space and place in the United Kingdom. So some of the work that we learned from colleagues out in Brazil, we took back here to some of the communities that we were working with within areas with high socioeconomic need, for example. So I think it's a really interesting space and place. So sometimes the design isn't just the design of products, it's also designing and thinking about the design thinking in terms of you know, the way that we work alongside people and what that is. I don't know if that's answered that properly, but it feels to me a really important area.
Yeah, thanks for the response. We have one of our viewers wondering what your experience has been like networking with industry representatives and crafting the initial sales pitch regarding why your services would benefit the industry?
Yeah, no, these are great questions. So I'd never worked with industry before. I started in Lab for Living, and it was a really, really interesting experience, because I think what I had to learn was a way of articulating what occupational therapy is in an incredibly useful and concise way, in terms of speaking to an industry partner. Often industry is looking at profit and looking at how do I maximize profit, how do I create something for a maximum growth of something, and actually being able to talk about what value is on multiple levels was a very, very steep learning curve, and it wasn't something that I was familiar with. It wasn't something that I necessarily felt very comfortable with at the beginning. Occupational therapy, what? Who are you? What does that mean? But gradually, as people and industry have seen the results and what we offer, now I am contacted kind of by kind of very significant organisations of people wanting to utilise the skills that we have. In England, I don't know if this is the same in America, we are a well-kept secret, but the minute you start to describe what you have to offer, the perspectives that you bring, the way that you can build understanding of the needs of people that are using products and services, from the perspective of industry want to create products that people will use and want, and really that's about understanding people's needs and assets and being able to kind of marry those things up. So companies then become incredibly interested in terms of the ways that we work and the kind of conversations that we have, and as a consequence of that, everything gets turned again on its head, because people then become very, very interested in what we do and start to say, well, why aren't we employing occupational therapists? Yay! And then my job is done. But yeah, it's been a very steep learning curve, and I'm still learning. I don't think I always articulate it very well, but I just feel that once the industry see what we do and what we have to offer, then it's just so powerful. Because in many ways we want the same thing. We want people to be able to benefit in a maximum way from and engage and be socially and culturally and physically connected and able to live out the things that they want to do. And if you're working with a company that has an ethic that they want to create products that are going to promote quality of life, well-being, and enable people to do more things, then that's fantastic. Yeah, it's been a steep learning curve.
On a similar track, we have a participant who's wondering about when you're working on interdisciplinary teams with other individuals who might not have a good understanding of what occupational therapy is and does, do you take an active role in helping them to understand OT's unique perspective? At Boston University, we often practice what's considered an elevator speech, 30 seconds of explaining to somebody, maybe a CEO or president that you're making a pitch to, about why OT would be important or what role it would bring. Do you have a version of that you use?
Oh, good question. I would say probably I think what I've learned is I've learned to listen to the language that my colleagues are using, and then to find a way of connecting to that, and often understanding that language that they're using and translating what that is. As I say, I work across this enormous breadth and field, really, and I think that often I can use this language, but it's not until I show people what I do, or people see what I do, that there's a lot to be said for having examples of things that we're engaging in, and you know, and the outcomes and what they mean. Yes, it is a pitch, but it's also a working practice, I think, and it's also a way that people can visibly and visually engage with it, you know, so that people go, oh, that's it. Oh, that's what you do. Oh, I understand that now. And, you know, just by articulating that through some of the things that we create or the things that we do, having these tangible examples often help people to understand far more clearly what it is that occupational therapy is. And makes it slightly more concrete, I think. But depending on which part of the interdisciplinarity that I'm working with, you know, whether if I'm working with engineering colleagues, for example, or if I'm working with, you know, I might be working with industrial designers, or I might be working with technologists, or I might be working with, I don't know, consultants. You know, it all depends on who they are. A lot of the time I find I'm the person also translating between colleagues in fine art and industry, or, you know, so I think, again, as OTs, we're very good at connecting. We're very, very good at connecting. Am I all right just to share a couple of very final examples? I think because I think the time is going really quickly. Am I right?
Yes, we have about 10 minutes remaining, so why don't you go ahead and finish up what you got to finish.
Is that all right? So just on the topic of just continuing, just some examples of maybe some of the lessons that I've taken from these last 10 years. I'd just like to kind of share some of the, just some more examples. So the picture that you can see of the model wearing the what probably looks a bit like a polo neck jumper. This is called the Sheffield Snood, and it's a project that we undertook with people living with motor neuron disease. So this is a medical device, but actually it's a garment. So we know that people living with motor neuron disease, one of the big challenges that they face in terms of engaging in activities of everyday living, in terms of eating, in terms of interacting with other people, is as a consequence of people's neck muscles deteriorating. And this was a project that we worked with people living with the condition. So we had an expert group of users, and we worked with fashion designers, and we worked with material scientists. And through this iterative process, we knew that people living with motor neuron disease did not wear their neck braces very often because they're very uncomfortable, they're very cumbersome. But actually using this way of working and designing something that looked much more dignified and almost a bit like a polo neck jumper, it meant that we've seen people wear these products 85% more time. And one of the lovely things as an OT is that people living with motor neuron disease get in touch with us and tell us where they are now and what they're doing and the trips that they're going on. So, you know, very, very simple interventions working in these very multidisciplinary groups actually can create incredible change at a significant level. The other two examples that I've got there on that page is the jam jar at the bottom. Is a product that was created again as part of the work in Lab for Living with Design Futures, and the product, as I say, it's a jam jar that's 40% easier to open than existing jam jars. So there's something really interesting also about that. Again, how do we work and how do we take our knowledge and actually make it easy for everybody? So we have a number of projects that are looking at packaging, because actually packaging is and poor packaging design can be a big cause of malnutrition, and you know, we need to think about that. You know, people in hospitals in Australia have over 40 pieces of packaging to open during a day, and again, as OTs, maybe we need to also think very globally about the kind of areas that we might focus in. So sometimes I've learned that very diverse things. Oh, packaging, what does that have to do? Well, packaging has to do with being able to open, being able to cook for yourself, being able to nourish yourself, being able to have a role and feed your family, have independence. You know, very, very interesting. But I think what I've also learned is that there are very different ways that we can engage and share what we do and interact with communities. So we've been running a number of hackathons of just bringing together, again, very diverse groups with end users, examining very, very different topics. So bringing industry with local government, with healthcare practitioners, with end users, with designers, and over a 24 or 48-hour period, literally identifying an issue, a design challenge, and then working together to start the first iteration of a possible response to that. And I think there's something that's really useful in that respect. So thinking about maybe different ways that we can work and harness communities when we're thinking about designing and thinking about, you know, what we create. I've learned also from the wider design community in the UK that in England we're not very good at shouting what we do about what we do. I think, you know, the Design Council led a number of design challenges around design and social impact. They led something called the League of Meals, where they invited people to share their cooking tips, older people to share their cooking tips. They ran a project called Casserole, where they invited older people and people to cook one extra meal that they would then share with somebody in the community. And this cooking and food, etc., were things that OTs we do. And to me, this is very OT, but I think the designers they're very interesting in how they articulate what it is that they do and how they call that. And I think I've reflected on that. So that is something. And I think, as I say, the other thing that I've learned about is that bringing together designers and OTs. So at the moment, within our lab, we have students who are on placement from occupational therapy working with students in design. You know, we have our students going out into communities with other designers, you know, looking at how to build understanding of ways of redesigning broader environments. So again, thinking about the context of the environment and design in its broadest sense. You know, it's not just about physically enabling people to access, but also kind of culture, thinking about ways that we create spaces where people want to be and want to engage and want to experience well-being. So I think, you know, as I say, the last 10 years have been a really interesting journey. I think as an OT, I absolutely believe that we've got so much to offer in this world. I think that my design colleagues would agree, and I just see a very, very natural way of working. But I also believe that as we move forward and as things begin to change, and you know, we know that health contexts are changing at present, that having and moving beyond a very traditional area of occupational therapy practice into this broader sense of design and the environment. You know, I think we're incredibly well placed, but I think we have to be brave and we have to step out there. But in fairness, if I can do it, then anybody can do it. And I think that I would encourage anybody who's interested, you know, please get in touch with me at Lab for Living. If you want to find out more about what I do, this is a tiny fraction of a whole range of different projects that we run, but you would be so welcome just to ask these questions and to interrogate me a bit more, because it is just such an incredible privilege to do this work, but also to see how change can be affected at national and international level, and to have people knowing and understanding what our unique contribution actually is to this field. So I think that's probably where I should end.
Okay, thanks so much, Claire. Are you okay to take a few more questions?
I would love to take a few more questions. No, as long as I've not just gone on too much. It's a very strange experience doing a webinar when you're not there.
Well, we do have, so Amy wrote in and she's wondering about that jam jar you showed earlier, the easy open jam jar. And she's just wondering if you could talk a little bit more about what makes it easier to open.
Absolutely, yeah, of course. So ordinarily in a jam jar, the focus, the pressure and the effort that is needed to put in is on a kind of on a horizontal plane. Whereas this jam jar has it's a press action, which is much easier in terms of pressing to break the seal and then very simply turning. So my engineering colleague Alistair Yoxall, it was working with Alistair as a way of, and basically Alistair worked with thousands of older people. So we have a lab in the lab where people come and open different piece of packaging, but in understanding the forces that are required enabled Alistair and the team to say, well, actually what we need to do then is to very simply, you know, why are we working against gravity, if you like? Why are we making that difficult? Why is it really awkward in terms of the, you know, with the power coming from the wrist, when actually we can press down, and that is a much easier action to have, because actually we're then working with gravity rather than against it.
We've seen throughout your presentation some of the evidence of your photography background. I'm wondering whether or not there are other parts of your practice that have maintained that passion of yours, and if there's ways that you think other OTs can incorporate photography into the work that they do.
Yeah, definitely. I mean, I think, you know, as I say, I mean, photography is a hobby. It's a leisure activity that people really enjoy, but also it's a research method. There's a whole method of research called photo elicitation and photo voice. And photo voice brings together communities using photography as a way to talk about what's important. And so, you know, one of the questions that I have is, as occupational therapists, and, you know, we are incredibly creative in many ways, you know, why do we not use photography more? You know, it's so easy now. Most people use photography on their iPhones, but it becomes a way that we begin to understand people's home contexts, people's life contexts. We begin to understand, you know, people's day-to-day lives, and it gives people a language that goes beyond just pure words. Particularly many of the communities and people that I work with are language challenged, so they struggle to articulate things very easily. So photography becomes an incredibly powerful method to do that, and also just to take people to the home environment. The project we've been running around technology in the home, we imagine our own homes, but, you know, when people bring photographs of their home environment, you suddenly think, gosh, no, of course it doesn't fit in there. That's really inappropriate. What does that mean? So photography, I think, is a great thing. Photo voice is a fantastic method that brings together communities and empowers communities. Again, is something that we would certainly, you know, is what we do. I should say that a lot of the work I do is around self-management and helping people to develop ways of managing their own conditions. And, you know, we've got, I did a big study about self-management and dementia called Journeying Through Dementia, which is the centre of a big randomised controlled trial at the moment. And that was all that originated through photography. Older people living with dementia photographing things that they wanted to keep doing, but they couldn't find the words to describe, and using those photographs as a way to have these conversations, and photographs within that intervention and visual images form a way that people can make very simple choices in a way when people are choosing what topics might be within themes within the programme around activities that they want to concentrate on. So, I mean, there's just so much that I think is untapped there, and we don't really talk about that so much in methods. And if you're doing a PhD, you know, and you're interested in alternative methods, I think, you know, photography is you know, it's well written about, and it has a very good track record. You know, there's a strong foundation around photography and using images. And again, I just encourage people to look at some of that literature and to try it. But also, you know, in the research that I did, what was lovely in the care homes, giving people cameras, people taking photographs to talk about what mattered to them. People were engaging in a meaningful occupation through the photography. So the method itself became meaningful, and people continued to take photographs after I'd left. And so again, I think the idea that as OTs we use practice as method becomes something that becomes quite interesting and exciting as well. I have such a fantastic job. Honestly, I can't believe it. Brilliant.
All right. Claire, thank you so much for your time. I think we're going to wrap up now. I know it's very late in the UK and we don't want to take up more of your time, but we've really enjoyed your wonderful presentation. We've had a number of our viewers writing in thanking you and saying it was a great experience. So thank you for this wonderful presentation on OT and designing for health. And thanks to everyone for joining us today. We hope to see you again on February 27th. We have another webinar and there will be 2 speakers. One will be speaking on OT in primary care and one will be speaking about OT in the NICU. So we hope to see you all there.
Perfect.